Hello and welcome to Health Live at Seniors Today. We are delighted to have here with, with we are delighted to have with us once again for his all his wise counsel, Dr. Sujeet Rajan. Dr. Rajan has been part of the Health Live series in the past. As we know, he's a leading respiratory physician from Mumbai. He graduated from the Grant Medical College in 1989 and postgraduated in respiratory medicine from the GS Medical College and KEM Hospital in 94. He also holds a diploma in environmental tuberculosis and respiratory diseases from the College of Physicians and Surgeons in Mumbai. Following his post-graduation, Dr. Rajan has been actively involved in research and clinical practice at the Bombay Hospital and the Bhatia hospitals, both of which are in Mumbai. His areas of interest are many interstitial lung fibrosis, airway disease, sleep disorders, and end-stage lung disease. The research he has done has focused around these areas, including asthma, COPD, diffuse lung disease. He runs an ILD clinic with online MDD discussions. He's a postgraduate teacher at the Bombay Hospital. He was also the European Respiratory Society's national representative from India to 2015 to 2018. He's also the editorial advisor for the American Journal of Respiratory and Critical Medicine and has, 40 odd publications to his credit. More importantly, and most importantly, he's a friend of Seniors Today. And we are always happy to have him here. There were a lot of queries that we received on the booster dose. And when we reached out to Dr. Rajan a week and a half back, that was the topic of the discussion that we wanted to have. Given the fact that everybody is talking about the booster dose. But since then, things have changed. And I think I last spoke with him on last Thursday or Friday, and we said, yes, this is what it is, booster dose, etc. And then since then, there's been, the news of the new strain of the virus, and obviously the discussion has, the questions that we've received are so many on the new virus, on the new strain of the virus. I've just about gotten used to the exact pronunciation of the virus, the Omicron virus. So that's what it is. And once again, delighted to have you with us, Dr. Rajan.
Thanks, Pradyuman. Thanks.
Tell me, as you know, we've just about, and I thought that it's perhaps time, perhaps with your session today, we would now put a full stop to discussions on COVID and all of that. And that's what I was speaking to the doctor last week, and he said, now it's over. COVID is kind of over, but it's all over again.
Yeah. So Pradyuman, when you asked me about boosters a couple of weeks ago, I was first of all concerned, and my disclaimer is that I'm not a virologist, epidemiologist, or a vaccine expert. I'm a clinical respiratory physician, and I enjoy my respiratory practice, especially interstitial lung disease, as you mentioned. But yes, we keep getting back to COVID, whether it's a booster dose or Omicron. And I think we are, to some extent, on top of it, at least where I'm practicing and what numbers we can see from India. And I do feel that our vaccination policy has really helped here. Having said that, it's very difficult to really predict what happens moving forward. Very difficult, very frustrating, especially for us clinicians who aren't in the lab all the time. I mean, we are getting information as fast as you or anyone else is getting these days. And so a lot of that information is not factual, is spread by social media sometimes, which has to be weighed in with what the evidence is and can create unnecessary panic. So I hope that the few basic things one understands about what is happening right now get across to people, whether it's this through this webinar or whether people seek information through reliable sources moving forward. And Omicron is really amazing in that it's just been less than a week since I first read about it. And it was identified in South Africa. And it's created such a stir worldwide. And understandably, because it's a variant of concern. So there are variants of interest and variants of concern. And for a lay audience that is tuning in, a variant of concern is that which can probably spread faster, infect more people, and disable whatever public health measure you have created to reduce viral infections, hospitalization. So that's why it becomes a variant of concern. We were not sure what was going on a few days ago when that case was reported out of South Africa, and I believe the first reported case was somewhere in Botswana. But there have been postulates about where it's come from, and the most likely reason, in my opinion, though I'm not sure, I have to confess I'm not sure, is that this was from a virus that was replicating in an immune-compromised host. And that means a patient whose immunity was very low, not vaccinated, and therefore free to mutate. And therefore, this scenario is most likely to occur in someone who's not been vaccinated or countries which have not been vaccinated. So I'm not sure if, I mean, they do say the WHO has said South Africa was the first country that reported a case, and hats off to them for reporting it. But this could be everywhere, honestly. And it's just how fast we can sequence the genes of the virus that will tell us how much we have. We've had already reports of cases in India in the last couple of days. So I'm sure it's there. The real question is going to be, is this going to be something that overwhelms people who have been vaccinated, double vaccinated especially? And is this going to be causing more serious COVID, which will land up patients in the hospital? From whatever little data I've been tracking in South Africa the last 4 days, yes, the cases are doubling every day. So therefore, that is of concern, obviously, to South Africa. But we will only know, Pradyuman, about how serious is this maybe 10 days down the line. So we are about 5 days into it. We are seeing cases double there. It's about from 200 to 1,200 when they reported it the next day. And it's 16,000 cases yesterday in South Africa. That's a lot. But whether the hospitals are going to be flooded with serious patients, that's the real issue. And we hope not.
Right. Thank you. Are you, let me ask you a question. Are you really worried about it? Are you worried about, because there are some sentiments, and I was reading an article, a report where the doctor who first detected it in South Africa wrote a piece that, there's just too much of unnecessary panic about the whole thing. So is this a reason for worry?
Just like it's named the variant of concern, I think there should be concern, but not panic. And I think the WHO also said that. I think that was one thing that really made sense coming out of them. It is of concern. For another 10 to 14 days, Pradyuman, we need to be vigilant. We need to watch the data coming out of South Africa and the rest of the world. We know that now quite a few countries, I've lost count of the countries that have reported a case. I would not let guards down. Of course, stopping flights and, I think those are policy decisions, and we saw that decisions made in the morning changed in the evening, a couple of days ago. But I think that's a bit of aggressive, because aggressive measure, because even if you look at Australia, which closed their borders largely once they heard about Omicron, they've already picked up 2 cases in Australia that have had no travel history at all. no contact with people who have traveled, which means that Omicron was probably in Australia as early as South Africa, if not earlier. So we really need to know more. I think we need to know more. If you're asking me what's my worry level on it, there is concern. But my concern is more that Africa hasn't yet been vaccinated significantly. And Africa doesn't have vaccines. So, and I think that's a concern being expressed across media. I mean, if you read media and you read a lot of it, Pradyuman, you must be following that. Global inequity in vaccines is huge. And I think when we decided to export vaccines in India, I remember the amount of criticism we faced because we didn't have it that time. But I think now we realize how important it is that the whole world gets vaccines. And it is sad to see there are countries which have actually disposed of vaccines. I mean, just imagine that, Pradyuman. I mean, you've disposed of millions of doses of vaccines when all of them could have been given to Africa. That is something we should be certainly concerned about.
Right. Thank you, Doctor, for those opening remarks. So we have a question that I'll get to the question, and those of you who have questions, please put them in the Q&A tab. If you have a very specific question about, you should perhaps put your age and gender so that Dr. Rajan would be able to give a more considered reply. The question that we have is, there is news that 2 people from Karnataka have the Omicron virus. And this person says, my sister lives in Bangalore. What are the precautions she needs to take? She's 65. And she has one more question, which is, I was booked to travel to Bangalore around Christmas to meet her. I'm 68 and my husband is 75. Is it safe to travel? We normally take very good precautions, masking, safe distance, etc. We're also doubly vaccinated. Should we take the trip? What is the precaution we can take?
I think, when it comes to travel, Pradyuman, my usual take on travel is what is necessary should be done. And sometimes what is necessary is necessary for a patient's mental health also. People have been feeling a bit suffocated sitting at home, especially people who enjoy traveling, and traveling is part of their lives actually. So if you were to ask me about Bangalore in this specific question, I think I don't see any increase specifically in Bangalore that is of worry right now. But having said that, the usual precautions, and I think wearing a mask, distancing, and hand hygiene, just 3 simple things, and of course getting vaccinated. I mean, there's such simple, straightforward things, but you see these non-pharmacological methods, which I call them non-pharmacological methods because that's the best way to term them. Just do the simple non-pharmacological steps to reduce transmission. And that is just wearing a mask. You see masks going down. So often I see patients talking to me, they bring the mask down and start giving their history. And I say, why do you need to bring the mask down to give your history? And then it goes back up promptly. These are just simple things, or they just feel that once they're in the clinic room, they don't need to wear a mask for some reason. I think that is important. At gatherings, you see people not wearing masks. You just wonder why. I mean, to talk to other people, you just don't need a mask. I do understand some of my chronic lung disease patients who are hypoxic with low oxygen and who drop oxygen on just talking and who don't have oxygen with them on hand, needing to take the mask down to breathe better. But that's a minority of people. I think that and distancing, just keeping a safe distance, not crowding up hospitals. And as I told you in an earlier seminar, consulting had become quite a pleasure because we allow only 2 people in the room. And instead of half a dozen relatives who all have their questions, and I tell them, look, if you all have so many questions, we'll schedule another meeting over a Zoom call like this, where you can meet the family in the city, outside the city, and outside the country. So there have been so many advantages of online interaction like this that you don't need to really stick to each other. Having said that, personal contact, touch is important, and I think that has been missing for people, and people have wanted to meet their near and dear ones, which is fine with me. And I tell them, if you feel it's necessary, go. And many of them do want to take that risk and travel. Having said that, I think if it's Bangalore, even if there are a couple of patients diagnosed there, I am quite sure there'll be a couple of patients in Mumbai soon. So there, if not more. And the same precautions, just maintain those precautions. Shutting down borders, yes, I think is going to be a very, very tough measure, and that is an extreme measure, really. And despite New Zealand shut down their borders, I think for almost, they had a lockdown after their wave for almost more than 3 months. So it's tough, and you need to be very self-sufficient to do that. Not easy, but I don't think it's a plan for the future unless things really go out of hand.
Right. But I must tell you, I flew Air India. I flew Air India some time back, and because it's a full service airline, they serve you meals, right? And when they serve you meals, and they obviously serve you meals, everybody is served around the same time, plus or minus 5 minutes.
Sure.
5 to 10 minutes, and when the meal is served, everybody has taken out their masks and they go down to eat it. So. Right. So clearly, while you might insist on everybody wearing a mask, but if everybody is going to be doing that, then there is an element of fear.
There is not just an element of fear, there is an element of risk in any closed environment. And as we say, an open air gathering is much safer than a closed room gathering. A gathering with fully vaccinated people is much safer than a gathering where there are unvaccinated people. If you look at the data from Israel also, where most of the data has been coming up on booster doses and vaccinated, they've done some amazing research there on vaccinations and booster doses. I don't know how they've accessed 1 million patient registry data there. But there also, I think you have a study which has shown that people who got infection after 2 doses of the vaccine had lower antibody titers for whatever that was worth. We don't recommend antibody titers as judging your immunity, and they're not recommended. But they're spike antibodies. So the spike protein of the virus is the target of most vaccines. And so if the spike antibody in the blood is on the low side, it is supposed to correlate with a lower immunity, but is not diagnostic of a lower immunity. So you can have low antibody levels and T-cell mediated immunity and all that. But that study showed that people who were getting infections had lower levels. And most of them were getting infection from unvaccinated people. So if you ask me, the dangerous, in inverted people in the community are those who are not vaccinated, actually. And because those people are not just getting infection, but they're also giving it to people who have been vaccinated, albeit a little lower grade. And so that sort of was the basis for their booster recommendation, which started in July this year. July 30th also was where Israel started its boosters.
We have a question which perhaps is more of a comment. These trains are like your new models of a cell phone, one every 6 to 8 months. How would you advise we should be ready for the future? And I'll ask the next question also, which is asking for advice. Can you please advise what medicines my wife and I should be having? Both of us are in our 70s. We would earlier have Limcy twice a day and Zincovit once a day. We are both diabetic.
Okay, that's. I'll go one question at a time. I think the first question was models of the iPhone. Yeah, so a new one every 6 to 8 months. We're likely to see more strains, Pradyuman. They're going to be there. Viruses mutate. For anyone who takes the seasonal flu vaccine who is tuned in, there are a lot of seniors tuned in. We change the seasonal flu vaccine every year. And Pasteur Institute studies the influenza virus strains in the Northern Hemisphere and in the Southern Hemisphere every year, and then rolls out a new vaccine. And sometimes those strains don't change for 2 years in a row, and they would have the same vaccine the next year as well. But they will always be looking at strains of influenza. For India, even though we are in the Northern Hemisphere, and this may be of value to the audience, so we need the Southern Hemisphere strains. So I think that's important to understand, because Indian influenza or seasonal flu is largely from strains from the Southern Hemisphere. But that just is an example to tell you, you take an annual flu shot, and in Mumbai, we would recommend it in April because our peak flu season is May to August. And the other flu season is right now ongoing, November to February. So the second, some people like to take it in winter. And I think in continental climates like Delhi and other cities in India, a November or October, November flu shot is preferred. The same way, we are going to see different strains of COVID-19 as well. And I think when the strain is a completely, when it goes from a variant of concern to a completely different virus, then you have to name it SARS-CoV-3 then, and that, hope we haven't reached that stage yet. But right now we have variants and they will be there every year. So if we can plug this vaccine into the regular seasonal flu shot within a year, I think that would be great. So people could get their annual flu shot with their COVID booster. As far as the second question is concerned, what do you carry with you when you travel? So this is, short travel within India. I think pharmacies and chemists are so accessible, you don't need to carry much. But when it concerns COVID, I think carrying vitamin C and zinc doesn't make much sense. There's now good data to show that none of these help. I know we've had sales of vitamins. I think people have had vitamins enough for their lifetime in the last 1 year. And so we need to be a little sensible here and not just carry vitamins when we travel. I think good things to carry are an antiviral drug for seasonal flu, like oseltamivir, and that's available. And probably an antibiotic if you're prone to frequent bacterial infections, though a few days travel, as I said, rarely would you need an antibiotic that fast. You can probably get back home and take it. So as far as carrying medication for flu, paracetamol is more than enough, and maybe some ibuprofen or naproxen if you get severe fever, which is not responding to paracetamol. Nothing else really for it to be careful about within India, because medicine is, in terms of availability, is immense. Physicians are there across, unless you're in some remote area. I mean, you will need paracetamol till you get to an area where you have medicines more accessible. A steroid inhaler has been, of course, shown in 2 trials now to be beneficial, and asthma patients carry them with them wherever they go. Even if you have mild asthma, it's now important to keep a steroid inhaler with you, because when you get an attack, you're not supposed to take salbutamol anymore, which was the old relief drug. Interestingly, the steroid, which is useful for acute relief in asthma, has also been shown in 2 studies to be effective for COVID. So I would carry that along for sure. And that's probably one medication that could work. And then we will have oral drugs soon in the market, ritonavir-based drug from Pfizer and the molnupiravir from Merck. There has been controversy about these drugs, but when they come, I think they would be very, very exciting, because that's what people would then carry with them. Right now, just oseltamivir, and we had zanamivir, which was an inhaled antiviral drug, but I don't see it available. Unfortunately, what happens is we just land up getting prescribed an antibiotic when you fall unwell. And so people carry antibiotics with them. Actually, they should be carrying an antiviral drug. And I wish, just like azithromycin, doxycycline is carried by so many patients, they would carry an antiviral as well. I think that would make more sense, especially when used early.
But what about, if you are in your homes,
Yes.
and the earlier advice was, again, for building your immunity,
Yeah.
one would just have a vitamin C and a zinc tablet every day. And now, of course, there is information that it's not really necessary. So is there something that one should have as an immunity booster, or just as a precautionary thing to ensure that you are fortified?
I think if there was really good evidence on that, Pradyuman, the whole world would be doing that. I have not seen great evidence on immunity boosters. Our immune system is based on, good nutrition, diabetes control, if you have it. That's keeping your immunity intact, exercising moderately, not necessarily intensely, sleeping adequately, and being stress-free. And I see some of my colleagues who follow these principles haven't had COVID or get very mild COVID, so that's a good immune system. I don't think there's a booster per se in terms of a pill, to pop in a pill. I know people take a lot of things, but I still think we have to see good randomized trials to show that patients who have taken those suffer less infections than those who don't.
Right.
And check your levels. Like, for instance, if you're taking vitamins, check your B12 levels, check your vitamin D levels. I see people taking vitamin D, very important vitamin. If your levels are below 30, for sure, take it. But if your levels are above 50, then stop taking it. Because the moment you have a high vitamin D level, you're going to have giddiness, headaches, and renal stones, because vitamin D increases absorption of calcium. So we've seen people taking extra vitamin D developing kidney stones. So we have to be careful with supplements as well. I mean, they're not completely harmless either.
Right. We have one more question about the Omicron. I'm in Delhi, and there's a lot of pollution here. Is the fear of COVID more in the winter months? Any special care?
No, I don't think, what we saw in Mumbai, in fact, we had the least COVID in the winter in Mumbai, in whatever winter we have in Mumbai. So, and we know that winter is associated with seasonal flu, not with COVID. So I think this is something, in clinical practice, this is what I've seen. I don't know what data shows, but there have been surges in flu during winter months across Europe and North America. And I think that's got ingrained in people's minds that COVID will also surge in those months. Look at India. We didn't have a surge in winter. We had a surge in March, April, May, and last year in August to October. So I think I wouldn't be too worried about the winter as much as not following non-pharmacological measures. If I had to give one message across this whole webinar, it is just follow the non-pharmacological methods. Wear those masks sensibly, encourage others to wear it, keep that distance, vaccinate yourselves, you can't force people to get vaccinated, but encourage them to get vaccinated as much as possible. And see that people whose immune systems are really low are protected. So for instance, I think if I was in any way involved in formulating policy for boosters, I think I would look at focus on those with weakened immune systems as top priority. And that would mean patients with HIV who are on regular oral steroids, cancer chemotherapy, and elderly patients. These would be top priority. They should get a booster if anyone should.
Right. So let's, on that note, let's move to booster dose, where we have quite a few questions. So the first one is, my friend took a booster by going to Delhi. He's 69. Should I also do it?
I have had this question so often in the last few months. I think there is no need. I mean, people are getting worried that they've not had their booster. I think the people who need to worry about boosters are those who have a genuinely compromised immune system, as I was saying just before this question. If your immune system is compromised, you are likely to not just be at risk of getting infection, you're not even likely to, have an antibody response to the vaccine. So a lot of the patients whom I've seen who have got infection after vaccination in the last couple of months have all, when we check their spike antibody levels, I would say 90% of them have low spike antibody levels in the blood. Whether that correlates with poor immunity, we don't know as yet, but it seems to. And so if your immunity is low, you may want to take one. How you get one is a tough one. I mean, people have been asking all kinds of questions. Some of them wait at the end of the day for vaccine doses to get over at centers, and all kinds of things have been happening. But I would say just be patient. I'm sure the expert committee advising government seems to be, waiting right now I think by next week we should have it. I mean, there's been so much concern about this particular question that I think by next week we should have a clear answer on when you should get your booster, who should get it. At this point of time, I think there are many people getting a booster before the actual people who need it are getting it. If I have to put it in that way, the people I've met who've had a booster are usually people who don't need a booster. And some of the people who really need one haven't got it. So I think that inequity, we should see that it doesn't happen in India.
Right. We have a question which is, actually quite a few questions on this. But is a vaccine cocktail advisable? Covaxin after 2 jabs of Covishield, or the other way around, or go in for a Pfizer elsewhere in the world, or whatever else is available here. So is a cocktail advisable, or is it better to
Yeah. Yeah. So we have to be careful with the word cocktail because there's the monoclonal antibody cocktail also. So the word cocktail has been used for that as well. But what you're talking about cocktail is, I guess, a mix and match, right? So a mix of 2 different vaccines, Pradyuman. I don't know. Let me be very, very honest here. I don't know, though. Whatever I've read about this in published data is that you can do it. You can do it. With the Pfizer-BioNTech vaccine, they gave a 3rd dose of a Pfizer dose. With Moderna's vaccine, a 3rd dose was given of the same vaccine. Whether you can mix and match, there are people who have mixed. I don't know if it makes a difference at all. Both are mRNA vaccines. In India, let's talk about India specifically, since this is largely targeted to an Indian audience, I would assume, Pradyuman. And Covaxin and Covishield, the AstraZeneca vaccine, are the predominant Serum Institute of India, are the predominant vaccines available. Should you give a 3rd dose? I guess you could, but we don't have the data to show whether that has any additional benefit or whether it could cause increased side effects, which is the concern, right? So I would say if it was a young woman, we know there was an advisory in the UK, women below 40, to take an alternative to the AstraZeneca vaccine. And so I would say in young women, look at an alternative vaccine. Now, whether Covaxin would be the right choice or an mRNA vaccine, on the basis of the current evidence, I would say mRNA. But we don't have mRNA vaccines in India. So we'd have to wait possibly till the end of this year or next year. We hope the government can, I think the indemnification issues were indemnity was an issue with the vaccine, and the government of India was directly liaising with Moderna and Pfizer, I believe. So if that goes through, we'll have an mRNA vaccine, and I think that may not be a bad idea for a booster. As far as the third dose of AstraZeneca and or Covaxin is concerned, I think let's wait for the expert committee to recommend it, because I don't think we have great data to support either.
Right. I have a question from someone who says, I'm 70 years old, was suffering from COVID in March 21. I have taken 2 vaccination doses, and should I travel from Bombay to Ahmedabad? So I know you've answered this question in the past. Do it only when it's necessary.
Yeah, it's a very straightforward answer. And this is what I tell every patient who asks me about TRAP. If it's necessary, do it. And that makes, I think, everyone think, including me, myself, when it comes to giving a lecture outside the city. Is it really necessary? Is it going to be such a difference that I'm physically present at that meeting vis-a-vis online? Then I would go. So I think that's the question the person needs to ask themselves. And as I said, often it's now boiling down to people's mental health, in the sense they feel much happier being outside their city for some time carefully rather than being in their city.
Right. We have a question from a 65-year-old, and he says, I had COVID last year, and now a year later, I've had an inflammation in the heart. Could this be a reaction of COVID? I've never felt any unease of any kind. How could this happen? I have taken both jabs.
He's got what in the heart, Fatima?
He has an inflammation in the heart.
Okay, myocarditis, I'm assuming. Yeah. 1 year after COVID.
That's right.
Yeah, no. So, a lot of things have been ascribed to being post-COVID, but myocarditis 1 year after COVID, I think he'll have to consult his cardiologist to understand that. We've seen it with vaccines, transient myocarditis in children, which has been most of the time self-limiting and recovered pretty well. And so I would not relate it to COVID infection that easily.
Right. Well, there are some questions which are there. I'm not very sure whether you want to answer them, but since they've been asked, are not vaccines unethical? I don't think we want to really get into that. But that's a sentiment which is there, Doctor. And there are some people.
What was the question about?
Are vaccines not unethical?
Unethical?
Yeah.
Why would the question be on unethical?
Given the fact that, these are all experimental, and so to say that.
Okay. Yeah. I don't think the vaccine is voluntary. We are not forcing, India has not forced any of its citizens to take the vaccine. You are creating measures where you're making it more difficult for people to publicly interact, visit places, if they have not been vaccinated. But I think we have been pretty conservative on that front, if you ask me. And so I don't think there's anything unethical in something that has been completely voluntary across the country.
Right. We have a slightly detailed question from Mr. Gurdeep Singh Straw, who's a regular with us. He says, I would like to ask Dr. Rajan, which vaccine booster dose should my wife and I take in the US, as we are presently here for some months? We both got the second dose of Covishield in April 21, and subsequently tested my wife on 16th April and I on May 1st. My wife, 62, is a diabetic for the last 3 years and was treated for breast cancer from April 2011 to November 2011. She was on tamoxifen 20 mg till October 21. I am 65 and an asthmatic since 95. We both are generally good health. So, well, he's in the US and he wants to know which vaccine booster dose should he take.
And he's taken 2 doses of Covishield, he said.
He is taking 2 doses of Covishield.
And it's more than 6 months since the last dose?
Yes, since more than 6 months,
Right.
the last dose.
Yeah. So if it's more than 6 months, so the vaccine antibody levels, neutralizing antibody levels come down after 3 months of the second dose. And after 6 months, I think it's a reasonably good time to take a booster. The US is giving boosters, allowing boosters. And I would suggest that they could take either of the mRNA vaccines, any one of them, either Pfizer or Moderna. I think that would be the best way to go. They're in a country where the mRNA vaccine is available. Take either one of them, one dose. And especially with the comorbidities he mentioned his wife has.
Right. We have a question from Suresh Khate. He says, what about taking steam inhalation? No medicines as such, but just preventive or curative actions, and what kind of such things can be done?
Well, it's fine, you know, for people who are comfortable with steam inhalations, that's fine. But we know we don't have, honestly, again, a randomized trial. It'd be hard to do that for people who've got COVID, not doing steam inhalations, and those who are doing it. But it is soothing to the throat and soothing to some patients' lung, and it's distilled water, remember that. So some patients, especially some of our asthma patients, get irritation of the airways when they inhale steam. So I'd say if you feel good with it, it's reasonably harmless. Just take care not to burn your face. That's about it. You know?
Right. Is there a minimum gap between the second dose and the booster that you've already answered? Doctor, is there a reason, is there a need for taking antibody test? What is the antibody count?
No, I wouldn't do it. As I told you, Pradyuman, the only patients we are doing antibody tests for are those who are a little confused about taking the monoclonal antibody cocktail. So as you know, the usage of the antibody cocktail has gone up tremendously in our practice in Mumbai. And high-risk patients, elderly, comorbidities, mild COVID within 5 days of infection or symptoms, infuse the antibody. It is expensive, but it's very well tolerated, and then they go home. And the youngest patient I've given it to is a 12-year-old boy, a 13-year-old boy weighing 40 kilos, which is just about the criteria. So having said that, that is something that is really changing the dynamics of COVID treatment. Until we get a pill, a really effective pill for COVID, I think the antibody cocktail would be the best bet. Now, obviously with the cost, and you're looking at 1,20,000 rupees, which contains 2 doses, and that's a lot of money, people are sometimes reluctant. And they ask me, should we really take it or not? And my answer to that question is, if you're on the borderline risk of complications, you're double vaccinated, then you may want to just check your antibody levels. And in those patients where we see low antibody levels, we don't hesitate and tell them, look, err on the side of caution, take it. So that is the only time we do an antibody level, actually. That's the only time I do it. Otherwise, it's for use in field surveys, epidemiological data on serosurveillance. But otherwise, in clinical practice, I do not ask for it because it confuses the patient. And some patients who have low antibody levels unnecessarily get anxious needlessly, whereas they actually have good immunity. And some patients with high antibodies think they have a free pass to do everything without any non-pharmacological protection. And that is what you don't want.
Great. Thank you very much, Doctor. We've had, there are many questions coming in, but all are under the same kind of heads in terms of the need for what kind of precautions, which you've answered, the gap between the last dose and the booster, the fact that, whether you should have a cocktail, as it's been called, or a mix and match of vaccinations. But clearly there are more questions than
Yes.
and perhaps, and I'm sorry to say, answers as well, because things are developing as we speak. And but clearly there's no need for panic, and I think that's the message which
Absolutely. And I see a lot of questions actually on the booster and as to why our government has not recommended it. And I don't know why they haven't yet come out with a recommendation, but all I can tell you is that I'm sure they will in the next week or so, is what I anticipate talking to colleagues who are closer to the government and their policies. And I think we are doing it sensibly. We did it sensibly in the beginning, and I think we need to continue to do it sensibly, which is bring in a policy where there's clarity who gets it, who is the first to be allowed to get it, and then gradually scale it up. And then, of course, children, because I saw some questions on children as well. I do treat children, a few children with asthma. And so their mothers have been, parents have been very, very anxious. And of course, we have said two things. One is asthma itself reduces your risk for severe COVID, in my opinion, and data has been showing that. And the second is that we have 5 ongoing trials in children going to happen very soon. I haven't yet seen a child in our hospitals having severe COVID. Most of them have been treated at home.
And doctor, how do you take care, because you're meeting, patients every day, and
Yeah.
while of course masking up is there, but that fear would be existing, and obviously
It
you've
is.
also not taken a booster shot.
No, I haven't. And yes, I guess, with having had COVID in September last year, Pradyuman, and taken 2 doses of the vaccine, I consider myself as being boosted by the COVID infection. So, and there are countries that have done that. I think you're aware. In France, for instance, if you have had COVID, that is considered 1 dose of the vaccine. So for people who've had COVID and taken 2 doses, you could probably wait a little longer. But if you haven't had COVID, I can see doctor colleagues and myself as well, we are still being cautious. So I'm definitely seeing less patients with more time. I'm enjoying that practice because I'm actually, I don't know if I told you this before, but before COVID, I think 80% of the patients that I saw were patients who didn't need a chest specialist. They could have been seen by a GP. But because we gave more time to the patients, they landed up coming to us. So now I'm seeing much less of that. I'm seeing a lot of problems being solved on the phone by general practitioners and by younger chest physicians as well, I'm sure. And the real complicated cases are the ones that need more time come to me. So in that sense, it makes my practice much more definitive in the role that I want to play. And I'm getting more time to read and research, which was not possible earlier. So I guess when you cross 50, you sort of change trajectories on what you want to do. But this came automatically with COVID. So it's been an experience of sorts. I see a lot of other people are stressed about coming back to work. A lot of our 60 plus doctors have semi-retired, literally. But I think when you see things that were probably done in medical practice unnecessarily before March 2020 coming down, I think that's portends good for health in the future. And we hope that that trend at least continues.
Great. Thank you, doctor, for your time and for explaining to our viewers here, to our readers, of what things are. I do know that some of you may still have questions, and as we know that things are still developing, my only request to you is that yes, WhatsApp is a great forum, or various other messengers are great forums for exchange of information and being in touch, but please do check what is being put out and get it verified. As always, because we interface with doctors every Saturday, we will be happy to ask them every time we meet a new doctor as to what the what the solutions are. And once in a while, every few months, we will again come to Dr. Rajan for clearing those cobwebs in our minds. Thank you once again, Dr. Rajan, for your time. And we will see you again next Saturday at 5 p.m. with Health Live at Seniors Today. Thank you.